Patient 25, ma'am. Yes, ma'am. Patient 25, ma'am, no? Sige, ma'am, proceed tayo sa room number 15.
Okay, ma'am.
So, good morning, ma'am. I am your tech for this morning. I am Zariel Marie Arsenbrano. Ma'am, mag-ask lang ako, ma'am, if makaintindi po kayo ng Tagalog or ano pong naiintindihan niyo na dialect, ma'am?
Pwede Bisaya.
Bisaya. O, sige po, ma'am. Mag-Bisaya tayo, ma'am, no? Ano pong pangalan natin, ma'am?
Nikki Reyes.
Sige, Nikki Reyes. Para i-double check lang natin, ma'am, ha, yung information mo. Para sure po tayo. Nikki Reyes po. Age po, ma'am.
22 years old.
22 years old. Birthday po, ma'am.
March 2, 1999.
March 2, 1999. Correct. Ma'am, ask lang ako, ano sa po imuhang last na menstruation, ma'am?
Last week pa?
Last week pa. Wala man ka na x-ray this year, ma'am, no?
Wala man.
Wala kay other na x-ray examination? Okay, so wala, ma'am. Ma'am, pwede ko mangayo sa x-ray request ni Doc?
Ay, kani ba to, ma'am?
Ay, oo, kani. Sige po, kani. Asa di ang sakit sa imuha, ma'am?
Kanang diri man dapit.
Diha. Nga na, unsa di ay ka, ma'am?
Kanang na-slide ko, tapos kani manggod, nagdiretso tukod ba?
Natukod ni mo, ma'am. Sige. Sakit man na, ma'am, no? Dili kayo ni mo mal. Ayaw lang kayo liyo ka, ma'am, para mahumanta, ma'am, no? Kani, ma'am, instruct ka, mag-change ka og patient gown, natay fitting room dito, tapos tanggalin na to atong jewelries and any metallic objects, ma'am, ha? Kaya parang maka-start na to sa atong procedure.
Sige, ma'am.
Ay,
Man ako, ma'am.
ay, sige, ma'am. Dali, proceed ta, dali, ma'am.
Sige, ma'am.
Sige, ma'am. Diha lang, tindog lang ta diha, ma'am. Magtindog lang ato ang patient. So, ma'am, mabutang taog gonadal, ma'am, ha? So, we put the gonadal shielding for the patient to be safe during the procedure. Next procedure, we have the AP and APH shell projection of the clavicle. So, instruct the patient to use gonadal shielding. So, ma'am, magbutang ko og shielding, ma'am, ha? Okay lang, ma'am. Magunit ko, ma'am. So, butang na to. This will protect the ovaries and the reproductive organs of the patient against catheterization. Assuming that the patient have worn with patient gown. Then, perform in the patient position, you have to position the patient in an erect position, or also you can do the patient in a recumbent or supine position, but it will be comfortable for the patient to be in erect position. So, you have to raise the chin, then ask the patient to mo tanaw siya sa kilid, sa unaffected area. So, ma'am, tanaw lang ta dito, ma'am. Then, so, tanaw lang ta dito, ma'am, ha? Then, the posterior shoulder should be in contact with the IR or tabletop without rotation of the body. So, ma'am, contact lang na to, ma'am. For the part position, you have to center the clavicle. So, this is the clavicle and IR to the CR. So, this is the IR. So, dapat nakasenter ang clavicle. So, it can be readily palpated with medial aspect of the jugular notch. The jugular notch is here. Here, you can palpate. And the lateral portion of the acromion joints, which is here above the shoulder. So, kani og diri. So, sa mid-clavicle siya ibutang. So, nakasenter na siya sa ato ang IR. Then, for, this is AP. So, the central ray for AP projection is to the mid-clavicle. So, ana siya. So, collimate. So, we have the collimation here. So, collimate on the central ray will be on the mid-clavicle. So, kani diri. So, sa mid sa acromion joints and the jugular notch, so diri siya dapit. So, ana ang central ray. Then, the collimation, collimate to the area of the clavicle, ensure that both acromion joints and sternoclavicular joints are included. So, ana. Then, do not forget to put the marker on the lateral side of the anatomy, and it will be included in the light field. So, ano na siya. Then, suspend respiration, ma'am. Alang talihok, ma'am. Shoot na ko. 3, 2, 1, shoot. Next, we have the apiaxial projection of the clavicle. So, same position, the part position, the patient position is standing erect. Then, yung ato gihapon siya, ang lateral, ang chin sa patient kay away from the area of interest. So, ana lang ka ma'am ha. Then, ang shoulder is got contact with the IR. So, make sure that there will be no rotation sa body sa patient. Then, the posterior shoulder should be in contact with the IR, ana. Then, center the clavicle and the IR to the CR. So, ma'am, adjust lang ta diri gamay, ma'am. So, this is the clavicle. You can palpate it here. Then, it should be readily palpated with the medial aspect of the jugular notch in the lateral portion of the acromion joints. So, for the apiaxial, the central ray will be 15 to 30 degrees cephalad to the mid-clavicle. So, same lang gihapon ang central ray, pero ang angulation lang sa central ray ang kinalahi. So, 15 to 20 degrees. So, paana siya? 15 to 30 degrees. Then, ana siya. So, same lang gihapon, mid-clavicle from AC joints and sternoclavicular joints. Make sure that it will be included on the collimation. So, ana, angulate the CR. Then, ask the patient to suspend respiration. Then, also, collimate to the area of the clavicle. So, ana ma'am ha, do not forget to put the marker on the lateral side of the anatomy. And make sure that it will be included on the light field. So, ma'am, alang talihok ma'am ha. And 3, 2, 1, shoot. So, here is the radiograph of the AP clavicle. We have here the structure shown is the clavicle. We have here then the coracoid process. Also, we have here the humeral head, the articulation. Then, a little bit, we have also the ribs and the lateral scapula. Then, there is an evidence of proper collimation because the joints are seen and the distal and the proximal humerus is also in profile. The entire clavicle is centered on the image. Here, this is the clavicle. Then the lateral half of the clavicle above the scapula with the medial half superimposing the thorax. So, here, this is the lateral half of the clavicle from here to here. Then, the medial half of the thorax was superimposed by the medial half of the clavicle was superimposed by the thorax. Then, soft tissues and bony trabecular detail was also visible. Apiaxial, we have here the apiaxial of the clavicle with angulation of the central ray. So, the clavicle was also in profile with the humeral heads, the coracoid process, and we have here the superimposition of the thorax. So, there is an evidence of proper collimation. Then, most of the clavicle projected above the ribs and the scapula, which is here, with the medial end overlapping the first or second rib. So, kani. Then, the clavicle in a horizontal placement. The entire clavicle along with the myoclavicular joints and the sternoclavicular joints, which is here. Then, the soft tissue and the bony trabecular details was also visualized. Sir, tapos na po tayo sa procedure natin ngayon. So, pwede ka na po magbihis doon, sir, sa bisanan natin, sir, para balik ka dito sa akin, tapos instructionan kita regarding sa result mo, sir, ha? Yeah.
Yan na go.
Oh. So, sir, tapos na tayo na, sir. Salamat ka. Salamat po. Tapos, sir, balik ka dito after 2 to 3 hours po para kunin yung result mo, sir. Tapos, pakita mo lang yung resibo mo, sir. Apo. Salamat, sir. Sige po, ingat po.